This is the Bahamas Tonight, Northern Edition.
Good evening, Bahamas. I'm Shoshana Roll-Farkas, and as always, it is so great to have you with us. Topping news, the Prime Minister delivering a New Year's national address last evening. The nation's leader telling the country that although it has been a very difficult state of affairs, there is still some good news for the country. Megan Shepherd reports.
Dear fellow Bahamians.
Prime Minister, the Most Honourable Dr. Hubert Minnis, noting that the pandemic has left many in a state of grief, financial hardship and poor mental health. He says that COVID-19 has interrupted the Bahamian way of life, with thousands of Bahamians still out of work. He adds that while the main priority during the pandemic was to save and protect lives, the government was also determined to help those in need.
To support our fellow countrymen, your government spent over $177 million through the end of October 2020 on our comprehensive COVID-19 response. The closure of much of our economy caused an immediate financial shock to many families. To help to support businesses and workers, we offered $44.4 million in tax credit tax deferrals, which funded the payrolls for nearly 7,000 private sector employees. Small businesses are part of the heart and soul of the Bahamian economy.
Now, many businesses were forced to close their doors either temporarily or permanently during this pandemic. Prime Minister Minnis says that in order to protect nearly 4,500 jobs in the small business sector, $47.3 million was made available for small business grants and continuity loans. An unprecedented distribution of unemployment benefits also occurred.
The government provided $45.5 million in unemployment support administered by the National Insurance Board. This included the extension of NIB's existing benefit programs, as well as support for Bahamians in the hospitality sector and self-employed individuals. This has been the largest distribution of unemployment benefits in Bahamian history. The government brought together the major food aid organizations and funded the largest food distribution effort in Bahamian history. $17.2 million in food support has been spent between March and October 2020, providing food for approximately 100,000 people to date.
The COVID-19 pandemic also put a strain on the healthcare and educational systems nationally.
On Grand Bahama, $21 million has been allocated for the phased redevelopment of Rand Memorial Hospital. Ladies and gentlemen, to help in the education of our children and young people during the pandemic, in 2020 alone, the government, in partnership with the private sector, purchased thousands of tablets and laptops for distribution across the country. In June 2020, the Ministry of Education purchased 5,880 tablets, as well as Wi-Fi devices for students on the lunch program.
The Prime Minister also noted the recent decline in new COVID-19 positive cases since its peak in the summer months. However, he added that it will take time to rebuild the economy and to restore livelihoods. Megan Shepherd, ZNS Network News.
The Prime Minister also noting last night that a COVID-19 vaccine national consultative committee has been appointed with the primary goal of advising the Ministry of Health in support of the national COVID-19 vaccination plan. That committee is chaired by Dr. Mercelin Dalregis and is made up of public health experts and representatives of various sectors, including religious and community leaders. He says the government will report at the appropriate time on the rollout of a vaccine in the Bahamas. Meantime, the Ministry of Health releasing the latest COVID-19 numbers within the country. The total now stands at 8,011. Now, according to the dashboard, 7 new cases were confirmed yesterday. Of those cases, all 7 are in New Providence. Of these cases, 5 are male and 2 are female. A total of 5 cases are hospitalized, all of which are also in New Providence. Now, 20 cases were reported as recoveries yesterday, and the death toll stands at 175, with 15 under investigation. And in other news, it's been some 10 months since the COVID-19 pandemic was declared by the World Health Organization. And at the end of the month, the United States will require all international travelers, including U.S. citizens, to show proof of a negative COVID-19 test in order to enter the country. Italia Hall has more on this recent announcement.
Travelers arriving in the United States from international destinations will now be required to take an RT-PCR COVID test 3 days before traveling to the U.S. Antibody tests will not be accepted. All passengers will have to share proof of a negative result with their airline before boarding a flight. And if that information is not provided, passengers will not be allowed to board. Resident Sidney McIntosh says he agrees with the new protocol.
I agree to leave the country because other countries maybe requires that in order for you to leave the Bahamas.
According to reports, the Center for Disease Control and Prevention will not require further testing within 3 months for passengers who have tested positive for COVID-19 and have recovered. In this situation, a passenger may travel with documentation of the positive test result and a letter from a healthcare provider or public health official stating that the traveler has been cleared for travel. This resident says he disagrees with the requirement as it will hinder Bahamians from traveling.
Because it encompasses a whole lot of money, coupled with the ticket, and then that's so much money for people to go. I don't know what the understanding as to why they would want you to have to take a COVID test to enter the state when the states has the numbers going through the roof. So that is counterproductive to me. And if you look at our numbers, I think we've done a very good job. You know, if because my wife is an American, to be exact, and so she's always boasting about how we did such a good job in the Bahamas.
Reports say the director for the CDC, Dr. Robert Redfield, says testing does not eliminate the risk, but when combined with a period of staying at home and everyday precautions like wearing face masks and social distancing, it can make travel safer, healthier, and more responsible by reducing spread on planes, in airports, and at destinations. The CDC also recommends for travelers to get tested again 3 to 5 days after arriving in the U.S. and quarantining at home for a period of 7 days post-travel. Now, the new requirement for all passengers traveling from international countries into the United States is expected to go into effect on January 26. Italia Hall, ZNS Network News.
The Prime Minister appointing an Economic Recovery Committee back in April of 2020. This public-private committee was tasked with making recommendations to the Cabinet on the long-term economic recovery of the Bahamian economy, including job creation and stimulating small business recovery and development in response to COVID-19. Now, one of those members appointed to that committee, President of the Grand Bahama Chamber of Commerce, tonight shares initial recommendations made to the government.
The Economic Recovery Committee, tasked with making recommendations to the government regarding restoring the macroeconomy, restarting a competitive business environment, economic diversification, tourism and transport, financial services and labor. According to committee member and president of the Grand Bahama Chamber of Commerce, Gregory LaRota, the Work Visa Initiative was one of those recommendations. He says this aims to entice persons to live in and work from the Bahamas for a 12-month period.
What we are targeting there persons who are in the technology field, for instance, that can work from anywhere in the world. And we're saying, why not work from the Bahamas? So those persons would not be competing with Bahamians for jobs. These are persons that are already employed.
He expands on the economic outreach and trickle-down effect.
These are persons that when they come, they need a place to stay. They need food. They need entertainment. And so we feel like, especially persons with high net worth, when they come to do business here, and we've seen a lot of positive response since that program was put in place. But when they come, a lot of them would bring their families with them. So some of them have kids that would have to go in schools. A lot of them would put their kids in private schools. And so we feel like that's an area that we can benefit from.
The Airbnb and vacation rental sector has also been growing in popularity in recent time. LaRota says that the committee believes that Bahamians should take advantage of this new business.
There are initiatives that we would have recommended for the government to encourage persons to get in those areas, assist them with capital or low-cost capital. To get in those areas, give them tax breaks so that they can get property and develop it. And so we think that has a great potential as well. We can certainly take advantage of our proximity to the U.S. And we've seen movement in that area.
And as the country, particularly Grand Bahama, remains hopeful for the year 2021, LaRota is encouraging residents to invest in the economic recovery as much as they can.
The Bahamas is still the place to work, play, and do business. So now is a good time to take advantage of some of the opportunities that we have here. Now is the time for even natives who have money that they can invest to take advantage of tax breaks and other benefits that the government offer, develop at home and help to jumpstart the economy.
Megan Shepard, ZNS Network News.
Thank you, Megan. While the Ministry of Finance announcing that Cabinet has approved the expansion of tax relief measures under the Special Economic Recovery Zone extension order for those islands. The approval comes under the Disaster Reconstruction Authority Special Economic Recovery Zone Relief Amendment Order 2021, which includes construction services in the list of tax-exempted activities until June 30th. Minister of State for Finance, Senator the Honorable Kwesi Thompson, through a release noting that construction activities remain a critical item for the post-Hurricane Dorian recovery process. And this extension order approved in December provided tax relief on the local sale and importation of construction supplies. The latest amendment order allows for the zero rating of construction services, which will render activities VAT-free until June 30th. There is a provision that specifically requires these services to be invoiced before June 30th and paid in full by September 30th. The time for the importation of VAT-free vehicles also extended. Replacement vehicles must be purchased and shipped prior to January 31st, representing a 1-month extension. Vehicles must arrive in the Bahamas by April 30th. Now to news from ABACO, news reaching our newsroom of an apparent SICKOUT at the Marsh Harbor Clinic. Based on sources, a letter outlining demands made by the nurses include the lack of bathroom facilities like a flushable toilet. These sources contend that the nurses have to tote water to flush the urinals to discard waste once it becomes full. Other issues include the lack of security protection since Hurricane Dorian, noting that nurses have been threatened and attacked when patients become irate. The lack of proper sanitization or cleaning of the clinic and inadequate lighting in the parking area at night are also areas of concern. The sources say that the nurses or the Bahamas Nurses Union have yet to receive a response from the letter, which was dated the 7th of December and delivered to the Ministry of Health. According to information reaching our newsroom, the nurses will continue to sit out until these issues are resolved. It is also alleged that the Marsh Harbor Clinic's administration and persons on the 52-week program are now assisting in screening patients. Now, we were unable to reach health officials for a comment on the matter. Switching gears now, the conversation remains a hot-button topic as the community of Grand Bahama was left in shock after a man attempted to abduct 2 primary school children from their respective schools last week. Tonight, a psychologist shares the prototype of a person who preys on kids and the lasting impact this experience can have on them. Behavioral psychologist Dr. Gregory Swan says individuals who prey on kids fall into one of 2 categories.
You're talking about someone who's a pedophile or a behavioral predator. And in both cases, they look to fulfill desires in themselves. They have difficulties dealing with someone of their own peer age. They find a greater attraction to minors. As a result, there is also some compulsiveness in their behavior, unable to control some of their innate desires, and it's easy for them to go out and prey on young kids. And here's how he says these kids are often targeted. Target vulnerable kids. They try to isolate the kids. They try to groom the kids, and then they try to fulfill in the kids what they find is some absenteeism, some behavioral absenteeism in the kids, and they'll try to fulfill the needs of those kids. But it's a compulsive predatory behavior where they go out and they would stalk. So one will go and in their mind they're trying to fulfill some association that is absent in their life. Dr. Swan says the impact can be a lifelong one. Whenever we prey on our kids, we break trust with relationship. We impact their view of adults. We impact their outlook on their health. And in the absence of providing them some proper intervention, we find that a lot of these kids who are victim of pedophile or behavioral predators grow up with deviant behaviors themselves. Dr. Swan adds that unfortunately, this behavior could be continued by the child, and this is why he notes the importance of providing a safe space for kids to talk about situations that may make them uncomfortable. Where there is someone in the public who are always trying to touch them in what they consider uncomfortable way, want to hold on them, want to kiss on them, and then from the parent side, you need to take note of your kids. Whenever you embrace your kids or whenever someone embraces your child and you see your child showing signs of uncomfortableness, then that's a red flag that you need to address. And I think it's an open dialogue between kids, school, and the environment that makes it, that provide for kids the opportunity for them to express what's going on in their life. 37-year-old Christopher Forbes, the Grand Bahama man sentenced to life in prison in the Turks and Caicos Islands last year, was transferred to the United Kingdom yesterday to serve the remainder of his life sentence. This coming after Forbes was charged for misbehavioral breaches in Her Majesty Prison, including several live streams which he hosted on Facebook from prison. Forbes, a native of Pinedale, 8 Mile Rock, was convicted of the murder of 2 Dominican women in 2016. They were killed in separate incidents and their bodies dumped in northwestern Providenciales. Stay with us. We'll be back in just a moment.